When it comes to learning how to use your pelvic floor muscles or to do what is often known as a Kegel exercise, I think it's helpful to understand the actual anatomy of the pelvis. So this is my bony and muscular pelvic model. I'm going to put it right here. This is where my pelvis is as I face you. So this is the waist right here. And in the front, we have the pubic bone, which is down here. And in the back, we have a bony structure called the sacrum. It's a triangular bone, and it's the base of the spine, underneath which is the tailbone or our coccyx, and that's about right here. Now, if we take the model and turn it this way, right in here is where your thigh attaches into your pelvis on your right side. This is your hip joint, and right in here is where the left thigh attaches. Down below, we have these two bones, which are called our ischial tuberosities or your sit bones. So you'd be able to find them if you sat down on a chair and you literally sat on your hands, you would feel this bone kind of pushing down into your hands. And the pelvic floor muscles attach in between these two bones. They also attach from the pubic bone all the way back to the coccyx, right, and the bottom of our sacrum. So your four bony landmarks are right through here. Now, from the front to the back, what we have is our labia majora are about here, and our gluteus maximus or our buttocks are down here, okay? Now there's different layers that actually make up your pelvic floor muscle. This is showing you the most superficial layer. You can see it right through here, right? And that covers underneath your labia, over your clitoris, around your urethra, and if you open up your labia, right the entrance of the vagina. Also covers down through the perineum, which is the tissue between the vagina and the anus. This is your perineum. And so many of you may have had some tearing, or you may have had an episiotomy, and this tissue can be quite sore and quite sensitive. And so when you're using these muscles, my suggestion is to be really gentle with yourself. They've been through some trauma, even if you haven't had any tearing, and there's probably a lot of swelling, so they're going to be harder to feel, and that's totally normal and totally okay. But the deeper layers, when you look inside, are like a bowl or a hammock, okay? So you can see this is the whole idea of that supportive structure. And the pelvic floor muscles have multiple functions, okay? Just really quick, we have the supportiveness for your pelvic organs. It holds up your bladder, your uterus in the middle, and the rectum in the back. So those muscles are supportive. They help you maintain your continence so you don't leak urine when you don't want to. You get a sphincteric type closure when you do the pelvic floor muscle exercises. They help you maintain your stool as well with closure around the anus. They help with sexual appreciation or orgasm as the muscles attach over the hood of the clitoris. And they're also part of our inner core, so they're super important to work. Now, when you're contracting those muscles, what you want to try to feel is a tightening and a squeezing around your vagina, and or a tightening and a squeezing around your anus. You can visualize and imagine that you're taking these two sit bones and you're trying to pull them together, right? You can also imagine taking your pubic bone and your coccyx and pulling them together like this. And then you can imagine pulling everything up and inside of the body. Now, as I said in the beginning, this can be hard for you to feel what's going on. So my suggestion would be an offer to actually take a mirror when you're ready, and you can actually take a hand mirror and look at yourself. And if you're looking down at your own vulva, which is the external genitalia, what you're going to want to see is a slight nodding of the clitoris. You might see a little wanking or a gentle pulling in around the anus, so the perineum might pull in. And if you're not quite ready to look at your vulva yet, although we do strongly suggest it because it is really good feedback, you could also very gently, when you're ready, just touch your own perineum. Maybe when you're in the shower, maybe you've taken a bath, and maybe you can just reach down when you feel nice and clean and just gently touch there and see if you can bring the awareness of what you're feeling into your fingers and try to pull those tissues away and pull them up and in. What is also really important is not just beginning to contract them, but you also want to have an ability to relax back down. So with any muscle, we want really good what we call range of motion. We're going to want to tighten and squeeze and lift, and then we're going to want to open and drop back to baseline. And eventually you also need to learn how to ideally elongate and allow them to drop down from your baseline. That's what's needed to help you have a bowel movement. So ideally we're starting with really slow, gentle awarenesses of the pelvic floor in all 3 directions. But do be kind and gentle with yourself, because this can take some time to practice. And certainly ask your physical therapist if you have any questions. But this will help with your blood flow. This will help with your healing. And eventually, again, you're going to help yourself with your continence, hopefully hold up your pelvic organs and sexual function as well.